Alright, so we're going to be talking about the shoulder girdle. Anybody know what the bones of the make up the shoulder girdle? Acromion is a part of a bone, but somebody said clavicle, okay?
Yeah.
Scapula. Okay. Now where's the one bony point that attaches to the rest of the skeleton? The whole shoulder girdle attaches only at one spot. Right here. The joint between the clavicle and the sternum. Right? There's what's called a scapulothoracic joint, but it's not really a true joint because it doesn't have any articulation with cartilage. So we'll actually plug that in. Well, technically the humerus is not really part of it, but you can't hardly talk about this shoulder girdle without. Right, so the word scapula means like a shovel or a spade, right? So you can see how it's kind of shaped like the tip of a shovel. I guess if you're a caveman, you could probably use someone's scapula to dig a hole, right? All right, so then, do you know what this is here? Spine of the scapula. And then, so then what's this part here? Infraspinous fossa, and then supraspinous. And then the one on the front. Yeah, so it's subbing below the scapula. Okay. So then we're going to talk about three borders. Okay. And actually there's a typo in here on when it gets to the angles. We'll talk about that in a minute. So there's three borders. There's the superior border up here, the medial border here, and the lateral border here. Okay. Then you're going to have angles here. You have the superior angle, you have the lateral angle, and you don't have a medial angle, you have an inferior angle. So cross out medial and change it to inferior. And then, like I mentioned, we have the different fossa. So you have the, what's this one up here? Supraspinous, infraspinous, subscapular. And those are the ones that we talk about as being origins of muscles. So what muscle is going to originate from each of one of those? The same name as the name of the fossa, right? Yeah. And then the other fossa we have is the glenoid fossa, which in this case is not an origin, it's an actual articulating joint surface. All right, then there's, and you see all these spots where it has a little picture of a thumb on there? Those are things that are on the handout that you should already have. If you don't, I think it's on the secure site. But if you don't have it, we'll get it to you. Those are all the things you're going to need to know for palpation for the final. Okay? And we're going to, today we're going to be taking all the tables out and doing a lot more palpation. Because the last couple of weeks we've done a lot of minute detail of anatomy and physiology and things like that. But now that we've gotten all that as a background, now we're getting into the actual nuts and bolts of it, and we'll be doing more palpation. So then there's other different specific landmarks. Anybody know what this one is right here? Coracoid process, right? And then we mentioned here the spine of the scapula, and then what's this portion in the end of the spine of the scapula here? Acromion. So that would make this joint called the what? Acromioclavicular joint. Right. And then this would be called what? Sternoclavicular joint. So then the clavicle, like I say, means a little key. Right? So then you have a joint on either end. And there's going to be a lot of different muscles and ligaments that attach to that. And then we mentioned about where's the bony attachment of the shoulder girdle, where it attaches to the rest of the skeleton. It's right here. All right, so then now we'll talk about the upper extremity. This part is the arm, and this is the forearm. Okay? But technically in anatomy, when you say arm, you're talking about this or the brachium, which is the humerus. Okay? And the lower body is the other way around. This is the leg, and this is the thigh. Okay? All right, so then here's where we're going to have a lot of these different tubercles and general terms about bones. A lot of times now when we're going to talk about bones, where do you think the head of the humerus is going to be? Up here at the top, this is the round curved surface. And then what's usually below the head? Neck. Okay. And now we have these bumps right here. Are they really big? Are they really, they're more on the smaller side, so we're going to call them tubercles. Okay. Not as big as a tuberosity and not as big as a trochanter. And then one's a little bit bigger than the other, so we're going to call one the greater, and one's going to be the lesser. Okay? And then there's a little groove in between here. What's that going to be called? Bicipital groove, or also intertrabecular groove. And depending on different parts of this, because there's quite a few muscles that are going to insert in that area. So we'll talk about the intertrabecular groove, which is going to be maybe a little bit farther down. Okay, we'll maybe talk about the lateral border of it or the medial border of it, because it gets into more specific details as to attachments of specific muscles. Then, as we go a little bit farther down, like I said, most of the muscles are going to insert right here proximally because they're going to get more leverage. Okay? There's going to be a few other ones that are going to insert a little bit farther down. What's this muscle right here? Deltoid, and that's going to insert down here onto the deltoid tuberosity. So in this case, this is one that's not going to be, it's going to be a little more distal than the other insertions. Then when we start, and then around here is going to be these greater and lesser tuberosities have a lot to do with tubercles. I mean, have a lot to do with the rotator cuff. So when we get into rotator cuff muscles, we'll be talking about. And then now as we get more distally, what other bones does the humerus articulate with? Radius and the ulna. Okay. And then here's what we're going to call the epicondyles. So you have a medial epicondyle and a lateral epicondyle. And then you have these supracondylar ridges. Okay. Here's where we're going to start getting into muscles, origins of muscles that go into the forearm. Okay. In this case, we're having a lot of the origins, instead of like in the shoulder girdle, they come from wide, large areas of origin. A lot of times these muscles, their origin is going to be a small point, like you have a common origin of the extensor tendons of the forearm. Okay, but we'll save that for another time because we're talking about here. So then we have specific things on this side here. Okay, on the radius, this is called the radial head. Okay, and then on here you have the ulnar. So there's two surfaces that articulate with these two bones here. Okay, the way I usually remember it is you wear a cap on the head, right? So the capitulum goes with the radial head, and then the trochlea goes with the ulna. So those articular surfaces, you have the trochlea that articulates with the ulna, then you have the capitulum which articulates with the radial head.